And we are.
Hello, everybody. It's Dr. David. Welcome to our monthly edition of our Ask Dr. David Live. And it's so wonderful to be talking to everybody. First and foremost, I think that this is the most number of questions that we've ever received ahead of time. So thank you for putting all those really great questions. I should be able to get through a lot of them. Not sure I'll be able to get through everything because there was so much listed there. But thank you so much. We really appreciate that. But also, welcome to the YouTube channel. As you probably know, besides this, I do a couple of YouTube episodes of Ask Dr. David Live per week, as well as the fun that I'm having over on TikTok in more of a quick response kind of thing as well. So if you haven't been checking out those things, check out if you like what you hear, what you hear here. Now, Shari is joining us off screen. She will be feeding me the questions as we go live. Of course, we always do answer our questions from our Patreon subscribers first. Again, thank you to all of our Patreon subscribers to help support this work that we do. We then take other questions as we go in through our patients, etc. And then if we have time at the end, we go through any questions that come up impromptu as the session is going on. Okay. Now, as I like to do as a disclaimer every time, this is, of course, should be considered one-on-one personal medical information. This is more educational purposes. I won't be going into any type of dosing regimens. I won't be going into any type of specific lab analysis for a person. And that's why we do offer consultations for patients in the state as a physician, as part of holistic pediatrics and family care. And for those who are out of state anywhere in the world, to do our educational consultations with Dr. David MD. All right, so I have to first get over to where these chats are in the first place. Okay. All right, so here we go. So the first question. We have seen huge benefits of taking vitamin D, but I keep reading about seeing more supplements with vitamin K added. Do you think that this is necessary or beneficial? Okay, that's a good question. In fact, there was a recent study that I read that actually shows it may not be all that essential in the first place. But let me explain the reason why it's discussed. So, vitamin D, as you probably know, enhances calcium absorption. Now, when of course, with magnesium, parathyroid hormone, it's supposed to put it into the blood, into the bone, but it also can be part of calcification of like our arteries and and our heart. And it's felt that vitamin K will drive that calcium not into the heart, more into the bones, away from the system. But as I said, there is some recent information that shows that might not actually be a concern. In general, though, for me, it depends on how high a person's vitamin D level is. So, as you may know, in general, I like to get all people with a vitamin D level above 50. And if it's kind of running in the 50s there, I don't know that I need to be adding vitamin K. I do have patients, because of whether they have autoimmune or mental health or immunological issues, where we're pushing more to the 70s and 80s. And that is where I think it makes more sense to be adding vitamin K. There are products that have them in combination, as mentioned. Some of them I have seen have way too much vitamin K in them, though, and it's a particular form of vitamin K. It's vitamin K2 called MK7. But in general, for about each 1,000 to have about 10 units of, micrograms of the MK7 is about right. So, if a person's doing about 5,000 units, around 100, it seems to be a good general rule of thumb. But I have seen some where every 1,000 has another 100, and that would, of 1,000 of D has 100 of K. And that would be too much if you start really doing to more of the therapeutic doses of vitamin D that we usually aim for. Okay. Thank you, Shari. What are your thoughts about Stella and safety for psoriatic arthritis, especially in a patient already taking things like Enhansa? Okay, so first of all, as far as what this is, and I actually did see this letter ahead of time, and I had put a little note in here to specifically say what it is. Okay, so there is a cytokine called PDE4. And with this Odzella, Atelza, excuse me, does is it reduces the activity to lower inflammation. Okay. Now, as far as transparency, I've never used this product. I may have had a couple of patients who are using it that were put on by other people. But in terms of being able to really give any firsthand information about it, I'm sorry, don't have that. Obviously it's been FDA approved for this. And of course, there's going to be the side effect list that we hear on all of the commercials that make us scared to death to do anything besides drink water, from those types of side effect lists that we hear. When it says, especially in patients who are taking things like Enhancer, which is curcumin, zinc, vitamin D, etc. Okay. Well, if things are being controlled from an autoimmune perspective with other things, of course, then a person probably doesn't need that kind of medication in the first place because things are under control. But of course, if going through various, and obviously there's lots of other things from an anti-inflammatory perspective, dietary modifications to obviously gut health and all those other things, as well as the nutrients, as well as other supplements that we use that but if they're not working, if a person's still having symptoms, then of course they should look to additional things that are out there. And of course, with everything in life, we should be weighing the pros and the cons versus the alternatives that are out there. That's what the definition of informed consent is, as we've spoken about. So, I would certainly say this certainly would need to be on a more case by case basis, in terms of the benefits for it. And obviously, the safety is what it says in the package insert without me being able to give more details than that. But thank you for your question. Okay, getting up the queue here. All right. All right. We heard from a parent who has a 4-year-old son with autism who has sleep disturbances at night and does not get 8 hours of sleep some nights. Now, she did send this viewer did send in the parent did send in a series of questions, so we're gonna go through them one at a time. All right, number one. We have been giving melatonin 1 to 3 milligrams almost every night. We try not to use it, but nothing seems to calm him enough to fall asleep without it. What are your recommendations for melatonin use? Okay. So, number one, if nothing else is working, that is appropriate. So, as you may know, melatonin is a natural hormone that we make in our brain, in our pineal gland, whose job in a cyclical pattern through the course of the day is supposed to be low during the daytime and come up at nighttime to induce us to go to sleep. Now, I've always felt that if taking melatonin is the only way that gets a person to sleep and it works, they probably were melatonin deficient in the first place, just like you wouldn't give insulin to somebody who wasn't insulin deficient, right? Unless there was some control of type 2 diabetes that was helping, but in general, but if you gave insulin to somebody who didn't need it, it wouldn't do anything except for cause a side effect potentially of hypoglycemia. So if you need it, you need it. And of course, 1 to 3 milligrams is a relatively low dose, as with any type of hormone or any type of treatment, we would want to use the lowest dose possible. So if 1 milligram is working, great. I have seen people using 5, 10, 20 milligrams of melatonin. That to me does seem a little bit in the excessive side, but still, I would want to know how it's working for the individual in the first place, because we've talked about all types of other things, proper sleep hygiene, how parents respond to the tantrum or waking up, in terms of maybe they be doing something that may be kind of reinforcing the behavior, like going to them all the time or etc., giving them food as a reward to get them back to sleep. And that obviously can just bring more of that type of behavior in the child. To L-theanine, to CBN and CBD. So lots of options that are out there. And of course, one should talk to their healthcare provider about that. And obviously, hopefully, it's somebody with functional medicine knowledge to give you the answers that you want. Okay, now the second question refers again to the 4-year-old boy with autism whose sleep disturbances included middle of the night meltdowns. He will wake up screaming, and the parents cannot calm him down from 2 to 4 a.m. Sometimes he doesn't go back to sleep at all, leading to emotional day, of course. What do you recommend for these middle of the night awakenings? Okay. Well, I personally have found that, again, using CBN does seem to be something particular about that keeps people asleep, and that is quite wonderful. But again, as I said, kind of part of the what is the parent's response? Okay. Because if you go to your kid when they cry, in their world, that's what's supposed to happen. And so then, hey, if I cry, mom's coming, dad's coming. So where is the um disadvantage, or how is this going to dissuade a kid from keep doing it? Okay. Now, I've always found that the most helpful sleep training program, and there's different modifications. It's called the Ferber method. I think I've mentioned it before, but basically, once you put the child down and you make it a short visit, you don't spend the whole long time in there with them. You walk out of the room and you wait a minute if the kid's crying, and then you go back in, and then you just very quickly, if the kid's standing up, put them down. Everything's okay, mommy's here, daddy's there, daddy loves you, mommy loves you. Something that's reassuring, obviously depending on who's in the house and part of the family. But and then that's it. Good night, bye, it's time to sleep. Kind of thing, and walk out. And if the kid's still crying, 2 minutes after that, so waiting 120 seconds before the next reappearance, etc. And you do the exact same thing, and you're in and out of the room for 30 within 30 seconds. And you keep on adding 1 minute to each break in between. And then the next night, you wait 1 minute. You wait. You put 2 minutes in before you go in the first time, etc. And you expand there. And so you add a minute for each visit on that day. You add a minute the next day. And there are people who do it with 5 minute intervals, etc. And that's okay too. But it's kind of more humane to me than just letting them cry it out. But they kind of have to learn how to self-soothe. We all do that. We all wake up in the middle of the night, whether we're not even aware of it, whether we go to pee, and we hopefully have the ability to self-soothe ourselves, right? So that's part of what, excuse me, L'chaim. But that's part of it is obviously understanding what the details of the whole bedtime routine is. Obviously a kid falling asleep is a different issue in terms of what we do leading up to bedtime. But if there's the middle of the night type of thing, and there are lots of other things that could potentially be helpful as well. But that to me is where I would start off at. All right, so the third and final question in this series comes from this is from a parent of a 4-year-old boy, I said, with autism and sleep disturbances. We currently give him liquid drops, methyl B12 and folate MTHFR and D3K2 and omegas. What vitamins should he be taking every day? Okay. Now, obviously, without knowing anything about the functional medicine workup of this child, what their MTHFR and other methylation genetics status is, that's why I like to do the max function genetics test, from Maximize Genetics. But again, unless I would know much more details, also about other aspects of the child, as well as the different types of lab tests that help guide us from a functional medicine perspective, the gut health tests, the inflammatory markers, the mitochondrial markers, all of that. I really wouldn't be able to say what a kid should be taking every day. And of course, kind of as said before, in the past, we need to be talking to a healthcare provider in functional medicine who knows this stuff, obviously, with us serving that role if you so desire, in order to really kind of bear down on what the right answer is. Okay. Oh, right. Actually, this is a bigger thing. I'm going to have to just kind of show up here. Okay. Okay. Next question. When my daughter was your patient, we determined she had MTHFR gene mutation. She now has a diagnosis of autism level 1, OCD, anxiety. After not previously using medications, we've now had some experience with Zoloft, cognitive behavioral therapies, and hydroxyzine at bedtime. She had some negative medications that have landed her in the ER with reactions. She takes Kirkman's, I guess that's a multivitamin with MTHF daily. Is there anything we should be looking into medically that would cause this, or any supplements that may help her? Okay, so kind of again, without being able to look under the hood and see what is going on individually with this patient, obviously I'm a bit hamstrung in what I can offer because I don't know. And so of course consult with me or somebody else. MTHFR, and it's been a little while since we've talked about it. So just in case people don't know what that is, besides as my dad, who is the first person who we found it on, and He referred to it as the mother effing what, which is kind of funny. And I've heard that from a lot of patients too, so it brings some chuckles around here. But MTHFR is methylene tetrahydrofolate reductase. It reduces a form of folate and it makes it active. And it creates 5-methylfolate. So it takes folate or folic acid, and the enzyme that comes from the gene, also called MTHFR, is it turns the folate on to methylfolate. And there are different gene mutations. In particular, there's a major mutation called C677T, and there is a minor A1298C. And the A1298C by itself is questionable whether it really is significant, especially if there's just one and the other one is normal. But as you get more into 1 versus 2 C677Ts, it slows the activity of this enzyme more and more. And fortunately, the proper remedy is to give activated folate. And most people will use 5-MTHF, the methylfolate. Some people don't do well. On our genetic test, we also look at things called COMT. People who have multiple COMTs may not handle too much methylation. And there is another form of activated folate called folinic acid, which we can also use to accomplish that. And of course, on the maximized genetics test that we do, the max function panel, it looks at about 70 genes, including the MTHFR. But even if one does not have an MTHFR mutation, there are other genes that are involved in this process that can show up on this test that could still bring the necessity of using methylfolate, or again, looking for those COMT genes to see if you should go another direction. And of course, there's a lot of other enzymes that code for genes that code for enzymes that are involved in all different types of B vitamin and other metabolism. Okay. All right, another series of questions coming in, and this is from the parent about her teenage, from a parent from about her teenage daughter, who recently had a positive ANA test, which stands for anti-nuclear antibodies. So it's a autoimmune autoantibody type of test. She has had several abdominal urine. Oh, I'm sorry. Abnormal urinalysis test. You can't have an abdominal urinalysis test. Sorry about that. Abnormal. So she has had several abnormal urinalysis tests for occult blood in the urine without being on her menstrual cycle. We were told by the PCP that lupus could be the most probable cause, but we don't have a diagnosis. Okay. Question number 1. In addition to lupus, what other conditions can cause a positive ANA? And it is possible for someone to have a positive ANA without having an autoimmune condition. Okay, that's a really good question. Okay, and it did come up for me about a week ago with another patient. So first of all, this is non-specific. Okay, there are more specific autoantibodies like anti-double-stranded DNA or anti-DS-DNA that is more specific for lupus. Okay, and yes, it can be seen in a lot of other types of autoimmune conditions. Hashimoto's can make it go up too. Okay, now there are some conditions that are not autoimmune. Okay. There are cancers that can make it go up. Actually, it's more commonly seen in people over 65. I realize that's not the person we're talking about, but there are people over 65 that it just goes off. That does not mean that they have any autoimmune disease. Now, of course, if it's there, we should check for a lot of the other autoimmune diseases, especially based upon the symptoms that a person is having. Okay, so there could be autoimmune kidney disease, for instance. And of course, if there's blood in the urine, that would be something that one would screen for. Of course, if a person is having microscopic blood in their urine, I'm obviously not sure how far of a urological or nephrology evaluation has been done. But anytime there's blood in the urine, there's IgA nephropathies, there's glomerular nephritises, there's nephrosis, and nephrotic syndrome, but usually there's more protein involved in the urine there. So, doing ultrasounds of the kidneys, making sure that there's no types of cysts or other type of anatomical abnormalities, sometimes, so obviously there's a big workup associated with the blood in the urine part. And yes, there are other reasons besides lupus or autoimmunity that can make the ANA be high. I'm going to take another sip of water while it's being loaded up. Okay. So another question regarding this teenager who recently has positive ANA anti-nuclear antibody test. Could environment or food allergy cause lupus or any other autoimmune condition? Or should anything else be tested like C-reactive protein, sedimentation, and celiac? Okay. So first of all, C-reactive protein and sedimentation rate are very general markers for inflammation in the body. A higher platelet count is actually one of those as well, but it has nothing as to what the etiology is, what the cause is. Okay. Um, Certainly, if a person has high levels of there, it behooves us as medical providers to look for the site of inflammation, the cause of the inflammation, to be as to what that is. You shouldn't just let that go because there's really, if those are high, I don't think that there's any reasons that's good that it makes it go high. Doesn't mean it's catastrophic, but it behooves us to look further. Okay. Now, I'm not aware of any food allergy that can cause lupus or any environment. Could there be environmental exposures? Excuse me. We obviously are learning a lot now about the forever chemicals, the PFAS, lots of other things in our environment that can screw up our immune system. So, would I necessarily say it's causing lupus? Well, that is a specific thing, and I'm not aware of any particular exposure that is to that. But you know, lupus, as with any other immune system abnormality, is a hyperactive and overacting immune system. Okay, and the body's attacking itself. So it's not just hyperinflammatory, it's autoimmune because auto attacks self. Okay. Now, are there things that can potentially worsen these things, like high sugary diets, low vitamin D levels, low zinc levels, abnormal microbiomes, etc.? Sure, all of those things are contributors. Part of the reason why we like to make sure that those things are all optimized close to day one of life, when we're checking moms during pregnancy and during lactation and checking all of our babies at 1 year of age, or the first time you walk into our practice. We recommend all of that. Again, methylation genetics with MTHFR, etc. In my experience, they go a long way, pardon me, in decreasing the possibility of developing these types of conditions, because it's so rare. Not to say it never happens, but it is so rare that we see those types of things develop in our practice. Okay. So living a healthy lifestyle overall, but those are things that we do also when we have evidence of autoimmunity, because we still want to try to minimize what's going on. Okay. So we have more questions relative to this. Okay. So this is relative to the teenager who had a positive ANA, antinuclear antibody. Are there any other tests different from what a rheumatologist would order that your practice would order in a patient if a patient is seen for a positive ANA test and blood in the urine? So, yeah, I think I kind of covered that, but just to go over it, I again would want to know a lot more about what's happening on the kidney level in the first place. Make sure that there's not some other type of pathology going on there, and then all of the stuff that we do, from methylation genetics to microbiome optimizing to nutritions like vitamin D and zinc, etc., are all part of the things that I would be looking for in order to try to help out. Okay, one final question in the series. Is it possible for someone to completely heal or test negative from ANA after testing positive? Okay, I don't want to use the word completely heal, because having an ANA in and of itself is not necessarily, again, a pathological state or a diagnosis. I don't usually see it coming down. Do I see symptoms associated with it, and these hyperinflammatory autoimmune symptoms improve? I sure do. Okay. But I'm stretching my memory here to see, it's not a big number at all in terms of making the ANA go normal once the the level is high. Okay. Because again, once your body is making antibodies, we have memory for that. Right? Just like with infectious diseases, you catch an infectious disease, or if you choose to get vaccinated, your body has memory, right? We have memory lymphocytes, we have T cells, we have memory cells, and they're making antibodies, the plasma cells, okay? And once the body is making those antibodies, just like it would be to an infection, Okay. And this is IgG antibodies. So we're not talking about IgE like with an allergy, which I've definitely seen get better. Okay. But since IgG is the antibody of long term memory, I'm not aware of anything that's going to program those specific white blood cells that make those specific antibodies, how to turn them off, but yet leave on all the good antibodies that we need on to fight infections and do everything else that we need to do. So that's why I'm not overly optimistic about that number being improved, but clearly we can bring improvement in terms of the patient. All right. Wow, today seems to be autoimmune day. We're getting more questions about some more other general questions for autoimmune diseases. So we're going to leave A and A. All right. So first, are there any holistic treatments, L-glutathione, N-acetylcysteine, turmeric, or any other supplements and therapies that have been successful in treating autoimmune conditions that do not involve steroids and autoimmune suppressants? Okay. So first of all, to all of those things that were mentioned, absolutely. All of them. And of course, it's a matter of getting the dose right, having a product that actually works. That's something that I vet all the time in terms of products based upon research. So while there's lots of glutathione products that are out there, there's only a couple that I recommend because there's been research that proved that it worked. And obviously the same thing with these other things as well. So I use a particular N-acetylcysteine product. I use a particular active, so turmeric, and actually it's the active ingredient curcumin, and it has to be activated in of itself for it to work. So all of those things certainly are things that that I have found success with. Low dose naltrexone, although it is not it is a pharmaceutical used at a very small dose, very common in the functional medicine world, that also can have immunomodulating without immunosuppressing qualities to it. And coming back to our old standards of is the vitamin D, the zinc optimized, gut microbiome. We know the importance of that in terms of limiting inflammation in the body, trying to, pardon me, trying to reverse that as well. So yes, that's my approach. Do you have any advice for someone with a child with a possible autoimmune condition? Well, I mean, I guess it also, I guess you could say, well, what are the symptoms that is happening? So obviously, if you're talking about an autoimmune condition like pandas, where there's an autoimmune antibodies that are being created initially against these viruses or bacteria, but also antibodies that can be against the brain, CAM kinase, some of the other things that are done on the Cunningham panel. So of course, anything that we could be doing to affect that would be really important. Okay. But so, and again, when you say possible autoimmune condition, I would say, well, is it or isn't it? It's kind of like possibly pregnant. Well, you kind of can test to see. But again, even if you take the word autoimmunity, and we just use the word hyperinflammatory condition, which I would treat the exact same way, whether it was, now granted, a lot of hyperinflammatory conditions turn out to be autoimmune, but not all, like sarcoidosis of the lungs. There's other examples as well. But still, if you got, if there's too much inflammation, reduce it. Do whatever you can. Okay. All right. Next question here. What is your view on a plant-based diet and the effects on autoimmune conditions? What if the child is picky eater and animal-based foods can not be completely eliminated from their diet? Okay. So a plant-based diet, okay, of which veganism is certainly the ultimate. And there are different ways that people have defined plant-based diets. I was kind of the way I was taught is that it's at least 85% of the meals are vegan. So if there's a few times a week that fish, or eggs are put into the diet, I do try to avoid mammals. That even me personally, I don't consume mammals for part of this reason. So it does reduce inflammation. Okay, it is one of the things that's known for that. Okay, now of course you got to give your kids something to eat. Okay, and you try and do as good as you can. You try to introduce things, you try and make it fun. Obviously, introduce foods that you think will work before you restrict your kid and give them nothing, and have nothing available to them. So, even through like, exposure therapy and types of things where we gradually introduce a food, whether it's first for having them smell it, touch it to their skin, maybe rub it to their lips, a whole bunch of things that one can do in that type of trial way to make them more comfortable to eat the food. Okay. And obviously, if you learn about and you can get your kid to consume 10 more foods that you didn't have ahead of time, and especially if it's covering the things that, what are we missing in meat? Iron and protein, pretty much. There's some B vitamins, of course, too. So as long as those nutrients are being met, that we don't end up depleted, we're not hurting the kid. Okay. But at the same time, I realize that not everybody can pull it off. And if it doesn't work now, try again in 6 months. Kids' palates change. I just heard from a patient of mine that I've been seeing. They live in Tennessee now. And I was seeing him since about age 3 or 4, and he just turned 13. And it was interesting because he started puberty. And I got a message from this mom. And this kid was a rough eater all throughout. He's eating them out of house and home. Anything that they put in front of him, he will eat. The families are foodies themselves. They can take him to exotic restaurants and eat all of that. So point being, sometimes things change and your kid is not the same person 6 months from now and isn't the same person from 6 months ago. So just because it didn't work in the past, don't give up. And of course, do all types of things before you start introducing a food to them. Talk to them about it if they can. Show them videos about people enjoying that particular food. Show them you enjoying that food. Maybe over enjoying it. Be dramatic about it. Maybe if there's somebody else there while you're feeding, you taste it. Maybe you just explain how delicious it is. Maybe you share it with another person in the room and have them explain how delicious it is. Just even over the top, right? And if you do that repeatedly, it kind of may facilitate in that child's head, hey, maybe this is okay. Maybe I'm missing out on something. They're all excited about this type of thing. But the one thing we don't want to do is we don't want to force it. Okay. We need kids to have a healthy, as all of us, a healthy relationship with food, right? We can't be thinking of this in terms of a punishment. We can reward. I don't like to reward food with other food, but certainly other things, whether it's something you get to play with, like a certain game, a certain security blanket-ish type of thing, or other object that they can have in the immediate time afterwards for consuming the food, but they don't get the rest of the time until the next time when they do it. So it's kind of still the incentive is there. But those are certainly all types of things I would take into consideration. All right. I would like to know your thoughts on the HPV vaccine. I have heard that it can cause side effects to some girls. Okay, is there anything that should be done prior to and after the vaccine? And are there instances where it'd be better to wait or avoid it? Okay. People can get side effects from strawberries. People can get side effects from every single medicine and every single vaccine. Look at the package inserts. Of course, it lists there. Okay. Now, granted, because I am in a practice that people come to me frequently because of vaccine reactions, I see a lot of kids who have those. And so I hear more about that. Obviously nobody says to me, oh, thank God my kid did not get cervical cancer this year. I hope it's not next year too. So obviously with something like a vaccine, you don't really hear people singing the praises because you didn't get sick, right? You're only going to hear about people who had a problem. So are there people who have problems with the vaccines? Absolutely. Every vaccine has that. So, to say it affects some girls, yeah, it does. It affects some boys who are doing it and who, as you may know, it is recommended to take that as for boys by the CDC as well. Okay. Is there anything that should be done prior to and after? So, we have our vaccine immune protocol using the same supplements as our more standard immune support protocol that we do starting a few days before any vaccine, as well as after any vaccine. It's actually the same thing we do for travel, like on flying as well. You figure if you know that the exposure is coming, try and get ahead of it, of course, with our immune support protocol. If you can't start it because symptoms haven't started yet, you don't know that a person's sick unless there was an exposure. So that's certainly one of the things that we encourage people to do is to take those supplements before and after. Are there any instances to where it'd be better to wait or avoid? Okay, this is me talking. This is not based upon any big papers that I've seen. Now, of course, with the exception that there are contraindications that are listed on the package insert of every medicine, as well as any vaccine. And by all means, I would review that information because there may be something specific to this individual that is kind of obvious. Okay. Now, we one of the things that I like to do, to be, as far as waiting, is like if someone walked into the office, I would say, "Hey, I have this immune protocol that you may want to do beforehand." So I guess in that moment, they may not have known about it because it was a new patient, and the kid needs a vaccine for school or something like that. And if the parent says, "I can come back next week," or they're like, "I just drove from Sarasota or from South Florida, and we want to use the vaccines you have because you're willing to do it one at a time, and you pick the ones that have the lowest, aluminum in it, and some of them, the different brands of a particular vaccine could be different," and I'll respect that. Again, family choice. They get to decide what they want to do. But yeah, if a family says to me, "I can come back next week and let me get these things going," that would be my preference. I do not like giving vaccines to people when they are sick. I don't like giving vaccines to people until 2 weeks after recovery. Let the immune system settle down. When you have an infection, you have cytokines, you have inflammatory markers that are probably revved up. Okay. Now, vaccines will cause cytokines to rev up too. So I don't want to have too much in that bucket. I want if there is kind of like an increase in the immune system, and it takes about 2 weeks or so before things kind of settle down. So to me, it makes sense. Yes, the Academy of Pediatrics will talk about it if you have a fever above this or if you're super sick. I'm a little more conservative than that. I kind of want a kid to be healthy. If they're having an eczema flare or an asthma flare, again, hyperinflammatory conditions, there's more cytokines and other inflammatory cells going on. So, as much as I can, I want the kid's immune system to be as balanced as possible, recognizing that's not always possible. But, from a parental choice perspective, this is not a vaccine that is part of any school mandate. Okay. But the reason why it's done is because there is no doubt it is effective in preventing cervical cancer and penile warts and some of those things there. Okay. And obviously, it is given at the age where those things are given. So, somebody could say, "Hey, if a mom says to me, 'Hey, I tested negative for hepatitis B, and my infant nor toddler nor elementary school kid is going to be shooting up or having sex. Why on earth would I want to give my kid a hepatitis B vaccine?" I think that's a fair argument. I think if someone said, "Hey, wouldn't it make sense maybe middle school is the new high school, or kind of closer to that, double digit age, before I would expose myself to that, because that's when the kid has a possibility of being exposed." Yeah, I think that makes more sense. But for this, as I said, at least with this particular HPV vaccine, it is recommended to do it at the time when there is the more likely chance. So, of course, while we all would hope that our children are not promiscuous, right? If we teach them about safe sex and condoms, of course, and hopefully they would learn and use them properly if that's the direction things are going. But we also do know that kids are not that, as a definition, teenagers are not the most responsible people in the world, and things can happen. And there's peer pressures. Sometimes there's people, some people don't respect no means no. People get raped during or other types of situations where things cross the boundary and things happen anyway. So those types of things do happen. Okay. So you know, it's an individual basis. Obviously, it's something that a family should be talking with their child. But I'm not one who believes that this is a vaccine that should be avoided by everybody at all costs, because cancer is cancer. Okay, we are on to the final question of today. So this comes from folks, somebody who's watching today's episodes. We did get one in, and they've submitted it through our live stream chat. So by all means, if you don't get your questions in ahead of time, submit it for next time. Okay. Okay. So final question. Oh, I'm sorry. There are three of them, not just one. So here we go. Why do some people who smoke live well into their 90s? That's a good question. My grandmother-in-law was one of those people. The that's true. My one of a dear person in our family, Shari, for those who don't know, is my sister, and she's reminding of my father's very an executive secretary who became family member and was another grandmother to us. So on my side too, not by blood, and it happens. Okay, we don't know why that kind of thing happens. Probably there's some good genetics involved with it. Sometimes you just keep missing the bullets, right? It doesn't mean that those people were overly healthy with other things. They just may not have died from it. Do they have the smoky voice and some of those other things? And we know that cigarettes are not just involved with lung cancer and disease there, but pancreatic cancer and colon cancer and other things as well. But Again, being a pediatrician, I have not delved into the geriatric literature, and maybe there are some predispositions that lead to that being so. But yes, it happens. Certainly, law of averages is you're probably not gonna make it that far if if you're a pack a day smoker. Certainly is interesting because one of the things that even that I do as part of like our intake when I'm dealing with bringing a new patient in, or if there's a kid who's having recurring respiratory illnesses, not just asking if the parents smoke, but is there anybody around them in their environment, in their home, in the car, etc. And certainly compared to 25 years ago when I started doing this, it's a small fraction of people who say yes, and much less than before. I mean, I can't remember the last time I had a parent tell me that. And sometimes it's the grandparent, or yeah, the dad goes outside. But it's not a common thing. So yay, America, yay, society, for recognizing that this toxin that really has no health benefit whatsoever is kind of fading out. Cigarette use, among the youth as well. Yes, they're vaping and doing other things and drinking still there, but cigarette use, the itself burning plant into their lungs, that it has carcinogens in it. It's on the decline, and that's a good yay. All right. Do you recommend sleep studies? I find these tests give us a lot of information in regard to the child sleeping. So I recommend sleep studies if sleep is an issue. Okay. By all means, if somebody is a snorer, and not just a mild little kind of snoring, but a shake the walls kind of snore. Another person in the room can't sleep. But also, is the child getting poor sleep? Waking up frequently? Is the snoring waking them up? Is it impacting them during the day? Are they more sluggish than you would expect them to be? Are their grades not doing well? Under any of those circumstances, absolutely a sleep study can be very helpful. Not all people who have sleep apnea snore. There's what's called obstructive sleep apnea. That's more the snorer. But there's also something called central sleep apnea, where for whatever reason, the person's body just doesn't remind the person to sleep. Okay. And then, but with sleep apnea, either way, if those oxygen levels start dropping to a point because the body's not breathing, and then your body gives your shot of, and it gives yourself a shot of in your kid, a shot of epinephrine, basically, adrenaline, and it wakes them up, and then they start to breathe. And every time you get that shock of epinephrine, that's not good for blood pressure. It's not good for the heart, especially for the long run as well. So yes, I do think it's very helpful, but it's not. I don't look at it as a universal thing to do. But when I had my sleep study done, and it was because I was a snorer and I was having daytime sleepiness, they told me that I was dropping my oxygen down into the 70s, the 70%, and it should always be above 90, at least mid 90s. They said that they could determine that my airway was shrinking down to the size of a pin. And they told me that if I didn't do something about it, I had a 40% chance of dying in the next 5 years. CPAP has been the world for me. I won't even take a nap without it. Fortunately, I'm very okay with it. It's very comfortable for me. I don't have any problems with it. But yeah, it absolutely can be a lifesaver, kind of sending you into the high blood pressure, heart issue, diabetes, all that syndrome X can really be a starting point. Could be sleep apnea. Okay. Our final question. Thank you for this, Shari. My 21-year-old son has hypertension and is on 2 medications. He is not obese. His blood pressure was over 200 before he started on the meds. His brother has double MTHFR genes. Can MTHFR hypertension? Not that I'm aware of. There is essential hypertension. I would have to double check the literature, but it's not something that I've ever come across. Now, of course, there are, again, without knowing what type of workup's been done yet, obviously there could be cardiac issues, there could be pulmonary issues, there could also be renal, kidney issues as well. So, of course, all things need to be looked at. Of course, nobody should be walking around with a blood pressure that high, and medications if necessary to bring them down. Definitely a place that I'm in favor of medications to bring that down. When the heart is needing to beat and push against a pressure of greater than about 130, let alone 200, the heart has to work, and it has to work much harder, and the wall thickens or it expands in the chamber. It makes the ability of the heart to not be able to contract as efficiently. That's why people eventually go into heart failure, because the efficiency of the heart is now compromised. So yeah, it needs to be figured out whatsoever. But I certainly wouldn't be putting all my eggs into the MTHFR basket. All right. Well, thank you so much. Please join us again next month. If you do want to go back on my YouTube channel, you can go back and see further. If you past episodes, if you want to, if you missed anything, go check it out. Please do help spread the word, spread the love about our message. You watch this because you like what you hear and it helps you. We want everybody to hear these messages. Not from me personally, but we think it will help the world. And as somebody who, as a physician, wants to help people and to heal people and give them better quality of life, we need this information to be spread far and wide. So please, do that. That also helps get us up on the algorithm so other people can search to find them. Again, subscribe to our YouTube channel. That's another way to get notified whenever we post any kind of video there. Still having a lot of fun over at TikTok. Our numbers are growing really well over there. And again, please join us on our Patreon as well. And also, lastly, if you don't know, we do have a newsletter. You can sign up for it at drdavidmd.com. Have a great day, great week, great month. Bye-bye.